Welcome back to the Girl Doc Survival Guide. Today I'm very happy to be with Dr. Sook-Bin Woo. Dr. Sook-Bin Woo, DMD, is an internationally recognized expert in oral and maxillofacial pathology at Brigham and Women's Hospital. She is widely respected for her expertise in the diagnosis and management of complex oral lesions, salivary gland disorders, and oral manifestations of systemic disease. In addition to her clinical work, Dr. Woo is a dedicated educator and mentor who has trained generations of dental students, residents, and fellows. She has authored numerous scholarly publications and is a sought-after speaker at national and international meetings. Her career reflects a long-standing commitment to excellence in patient care, education, and advancing the field of oral pathology. Welcome to Sook.
Thank you so much, Christine.
Can you first share a personal anecdote?
One that I always think back on that amazes myself is this time when I graduated from dental school. Our dental school is integrated into the medical school curriculum, my medical school friends, and I decided to go climb the highest mountain in Southeast Asia. In East Malaysia. I grew up in Malaysia. And this mountain is called Mount Kinabalu. It's about 13,455 feet. I remember that height. And of course, I never trained. I thought 13,000 is pretty high, but they said there was a trail, so I'll just walk up the trail. At that time, there's no internet. So I have no idea what the situation is. So I go with 4 of my medical school colleagues who are all men. We flew over to Kinabalu and climbed up this mountain. And it was so high, 13,000 is high. It was freezing at the top. I had no idea. I mean, I grew up in the tropics. I just wasn't thinking. I had a parka, which was the kind of parka you would wear if it was 60 degrees. And it was 32 degrees. We went all the way up. And of course, the air is very rarefied and you can hardly breathe. So you get mountain sickness. And we were so ill that first night. We had brought all this food that we were jettisoning on the way because it was so heavy. We were so sick when we got up to the top. We couldn't even eat any of the food that we had. The next morning, we watched the sunrise from Lowe's Peak, which is the very tip top of the mountain, which is above the tree line. It's completely barren. And we walked up. And of course, it was very, very beautiful. It was probably the biggest achievement of my life physically. Then we walked back down. And it was extremely difficult coming down. As you can imagine, you get a badge to say that you got up to the peak. Then after that, we took a little trip from Kinabalu, which is in Sabah, all the way across the country, which is part of Borneo, is the northern part of Borneo, all the way across westward towards the other end of Sarawak. Part of that trip, my 4 colleagues got stung by wasps in a very bad way because they disturbed a wasp's nest. We had to try to get them to the next town. And these were roads that were not paved. They were dirt roads. We didn't know how to get to the next town. And we managed to get this guy to take us in his Jeep on this unpaved road. And my 4 colleagues were all sitting in the back because they'd all been stung by these wasps, except for me. So I was sitting next to the driver, and we realized that he was completely drunk. He had a bottle of alcohol between his legs, and he was driving, and then he would fall asleep, and I would hold on to the steering wheel and steer the car. We had to even go over a little wooden bridge. I'll never forget it. I was so terrified, and I thought, I'm going to not survive this trip. I'm going to die here. But we did manage to get to the next town, which was Bintulu, a very small logging town where we had some friends. So that was one of the biggest adventures of my life. There's more to it than that, as you can imagine. But it's something that I always remember when you're young. You do reckless and crazy things, and you take these inordinate risks. And yet I think there is something to be learned from that. And somehow we survive. I think all of us have probably done things we thought, well, that was really probably not a good idea. But I think if we'd thought about it too much, we wouldn't have done it. And then we wouldn't have had the adventures that we've had.
Yes.
I was glad I did it, but it was very frightening.
It shows how adventurous you are.
But that was when I was young, right? So now a little less reckless, but adventurous. So I do love to travel. And I do travel quite a lot. Not so long ago, there was a conference in Istanbul, Turkey. It was one of the most amazing, exotic, beautiful places in the world. And then after that, I traveled on my own. I took little trips here and there. And everywhere I went, people would say, "Are you traveling alone?" I said, "Yes." And they're absolutely shocked that I would travel in Turkey alone. Again, I didn't really think about it. I didn't think, is this not safe?
Well, maybe your adventurous spirit actually translates to your career.
Well, I think it probably did to some extent because I went far away from home, not knowing exactly what I was doing, except that I really wanted to do oral pathology. I knew at that time that one of two top programs in the country was in Indianapolis. And my mentor was Dr. William Schaefer, who has since passed away, but he was an incredible researcher with a brilliant mind. He was old school. And when I say old school, I mean old school. This is in the 1980s. I had wonderful training. He was really a fantastic mentor to me. And it made me who I am. I was tough because of that training.
I think people who are old school don't think of it as a bad thing. I think sometimes the newer generation thinks old school, it's sort of a negative thing, like people are less tolerant, less accepting, maybe. Did it cause challenges in your career to train in an old school fashion?
That's a very good question, Christine, because I think I am a little bit old school. I know that all the people who trained in that program took that old school way of training. What does that mean, old school? It means exacting standards. You're going to know the answer. And one of the things that Dr. Shave always said to me is, "I don't know" is not an acceptable answer. I never want to hear you say that because I said that the first day. I said, "I don't know." He said, "You cannot say you don't know. If you look at a tumor and you don't know what it is, you know something about it. Something. You can't know nothing about it," was how he looks at it. And I think he is right. And I say that, and I hear myself saying the things he said to me. Like, you cannot say you don't know what this is. You know something about it. Tell me what you do know about it. The exacting standards, the rigor, that's old school. My mentor, he set a very high standard and everybody reach for that standard. I
Yeah.
think that is actually important that you set a high standard and maybe not every resident can achieve that, but they have to reach for it.
Yes.
They have to try. I think that's really important.
Yes. Do you think there's a way to have super high standards, to have that kind of rigor, and also be gentle and kind?
I do think so, but I think a lot also depends on who you've chosen to be in your program. The most brilliant applicants across the board, they're very, very good. And they already come in maybe with research in college and pathology background, and now they've done medical school. Then you can achieve that. High standard in is easy. It's harder, I think, when you get a resident who's a little bit challenged and maybe realizes at some point, I don't think this is actually cut out for me. I thought this was a good idea. It wasn't a good idea because pathology requires a very special skill. And there is a right and a wrong diagnosis for the most part. The rigor has to be there because you have to nail it. You have to know what you're doing because the patient's treatment may vary very considerably between one diagnosis and the next. And of course, sometimes we don't know what the answer is. And it is a skill to be able to present the fact that you really don't know what the actual diagnosis is, but you have a sense of maybe the biologic behavior. I think that's very important for a pathologist to have the humility to say, "I really don't know, but this is what I do know, this little piece of it." And I hope that helps you in the management of your patient.
Yeah. So I was going to ask you that if you've changed your mind on this, I don't know, but with what you just said, it sounds like you definitely always, at the very least, try to say the amount that you do know.
Exactly. I do believe that you really shouldn't try to shoehorn a diagnosis. How many times have we seen tumors that don't fit anything? They don't look like anything you've ever seen because, especially malignant tumors, they don't read the book. They just do whatever they want to. So it's good to be humble about it and say, "I really don't know, but
Yeah.
this is what I do know. I will tell you what I do know."
Yeah. That is the thing, right? Also, there are new things that we've never seen before.
Yeah, exactly. Exactly. And we have to just be open.
Yeah. Talked about your fellowship and a great mentor you had and how he influences you to this day. Is there some advice you wish you had known earlier that maybe you've changed your thinking on?
The advice I give my younger residents who are coming out is find yourself someone who's maybe 1 or 2 or 3 years a little ahead of you in an associated field that you are interested in, who's also interested in whatever academic specialty you're in, and work with them because then it's going to be easier for two of you to move up in the academic ladder because you have twice as many cases and you can bounce ideas off each other. It's close enough, but you're not exactly in the same field, but very related. And I think that really does help to progress in your career. And then you're going to have a friend for the rest of your life, someone that you work with.
That's cool. Good advice. I had never heard of emotional intelligence when I was younger. Do you think that skills like emotional intelligence, do you think it's relevant to what you do?
Oh, I think emotional intelligence is so important, not only in pathology, just in your life in general. I think some people are born with it, like they are just very empathetic. And I think if we think about our circle of friends, we probably can think of some people who are that way. And you go, I really like to be with that person. They're very kind, they're not judgmental, they listen carefully. They're really listening to you as opposed to waiting to speak. And I think that is important in every aspect of our lives. As a program director, it's incredibly important for me to be able to understand where my residents are coming from. I train a lot of residents from West Asia, and they come from a completely different culture. They have a different culture, a different expectation, a different outlook on life, and a different way of dealing with their teachers. They are very respectful to me, over respectful. And I have to tell them, no, you have to tell me when you think I want you to speak up. Sometimes even saying that, they're taken aback that you would even say such a thing to them. Being culturally sensitive, that's, I think, part of emotional intelligence. Understanding that they have their own lives and their own families that are making demands on them at the same time that I'm making demands on them, I think is incredibly important. And I'm a clinician as well. And I think that is also very important in being able to relate to your patients so that they feel comfortable with you and are then comfortable telling you some parts of their history that they might not reveal to you if they didn't feel as comfortable with you, which has a huge impact on how you would diagnose them and treat them.
Yeah. So, as a woman and an immigrant to the US, you've had and still have a really amazing career, very productive, very fruitful. Do you have advice on how to do that?
Well, it's so funny because people have asked me that question. They say, don't you ever feel like you were discriminated against? In general, I would say I was extremely well supported. I never felt it when I was in Indianapolis. I never felt it in New York, where I did my general path training in Long Island Jewish Hospital, a medical center. When I landed in the Northeast, that was the first time when I felt it. And that had to do with maternity leave. In the 1980s, there was really no maternity leave policy. It was essentially up to whoever was your boss to make that decision. So that was very hard. So I did not spend as much time as I did with my babies as I would have been able to do if I had them now. And I do feel that there is still a little bit of a disparity in wages between women and men, even in pathology. Salaries across the board is still quite different for men and women. These are institutions that have anti discrimination policies, but it still happens. I'm extremely grateful to Dr. Chris Fletcher, who, when he came to Boston in the 1990s, knew what oral pathology was, which most people do not, and supported me all through my career at the Brigham. I was so fortunate.
We're so lucky when we have these wonderful mentors and supporters around us, for sure.
We are, yeah.
So you have at least one child then, since you mentioned maternity leave.
Yeah. I have two children, and they're pretty much in their late 30s, so they're grown.
Since you had them in the 1980s with no maternity leave, how did you bring them up and manage your career? How did you do?
They are a joy and a blessing. My first child, I did put into a local daycare I live a long way from Boston. I have a 2-hour commute one way. It's a long way. It was not easy. And I think it could have been better for my kids, but there was no other way to do it. So I did have a local daycare. I immediately made sure that they were in a play group so that they had surrogate mothers when I was not around. And then when my second child was born, I had a live-in nanny for several years. After she left, I had a succession of nannies who came to the house. Some of them were just absolutely amazing, and some of them were horrifying, as you can imagine.
Wow. Do you still live 2 hours away?
I do. I lived in this home in Ipswich, Massachusetts for 40 years. And my children were raised here. I'm near Crane Beach, one of the most beautiful beaches in the northern part of Massachusetts. I'm about 2 or 3 miles from the beach. Every time I come home, I feel like I'm on vacation.
But every day you drive 2 hours to Boston.
Well, not anymore. I used to. I don't drive because it's more stressful. So I take the train. The commuter rail comes right to my town. And in fact, I'm only a 3-minute walk from the commuter rail. So I'll get onto that, change onto the green line, and then I'm off. On the train, I can write my exams, grade my exams, review papers, set curriculum. I can do so much on the train. And in fact, I wrote my first textbook, the first edition, entirely on the train. So that was 4 hours a day, uninterrupted time.
That's amazing. So advice could be, if you want a successful career like yours, live 2 hours away and work on the train.
One of the most anxiety creating situations is childcare, because your nanny or your babysitter is sick. What are you going to do? You have to have all these backup plans. I used to have a list of all the babysitters, those who could drive and those who couldn't drive. But children, they're blessings, and then they grow up, and I have a grandchild, so that's a blessing.
Oh, congratulations.
The other thing I would say is, if you're a reasonably smart person and you're a reasonably balanced and kind of centered person, it will all work out in the end. It does. It will work out. You just have to take a deep breath or many deep breaths, take care of yourself, and it will work, however dark it may seem.
However dark it may seem sometimes, yes. I agree with you. I look back and I wish I had believed that when I was younger and my kids were much younger, that it will be okay. Because I think I just would be so stressed so much of the time, like, oh, this and like, what now this? I wish I had just sort of been like, it's gonna be okay. Because I can say at this point now, we're still here.
And we're doing fine. Yeah, we worry so much. It's hard to see beyond what is happening now when it's bad, but it will work out. As long as you're grounded and you have social support around you, you will be fine.
Yeah.
It's hard to imagine, but it is true.
Do you have any final thoughts? It's been great hearing a little bit more about you.
Oh, this is fun. I think, to me, one of the most important things, whether you're in medical school, dental school, or in whatever career you choose, whatever specialty you choose, whatever you do, even if it's not related to what you do for work, is to just have curiosity about everything. I am curious. I am one of those people who wants to know everything. If I hear something and I've not heard about that before, I'll go back and look it up. It serves you well in pathology. It serves you well in your clinical practice to always be curious and go, well, that's odd. I've never quite seen that. I'm going to file that away. I might see another case just like that. But also just in your life, just be curious about the world around you and be kind to everyone around you. I think, to me, kindness is even more important than love in a way, because love can have all its difficulties and the baggage that comes with it. It is so intense. Whereas to be kind is easier, and we need to practice that more.
That's really wise. Oh, it was so fun to talk to you. Thank you so much for doing this.
It was so much fun.